Hello, everyone. I'm Dawn Gunderson, the Program and Communications Coordinator for Healthy Mothers, Healthy Babies, the Montana Coalition, also referred to as HMHB. A large part of my work is related to our LIFT's online resource guide that I will be presenting on today. In addition to my work, I am also a mother of 6 and I'm very thrilled to be working on this guide to improve the access to perinatal supports for Montana families. LIFTS stands for Linking Infants and Families to Supports and is an online resource guide created to help link and connect families in Montana to support services and events all throughout the state. The guide focuses on the perinatal stage, including resources for families during pregnancy and through the age of 3 years. The intentions of this presentation today are to give you a short overview of the history of HMHB, to explain really why the LIFTS resource guide was created, to tell you and explain how it was created, and then we'll also take a look at the resource guide and how it's set up. So to start with a little history, Healthy Mothers, Healthy Babies, the Montana Coalition, was created by a group of health professionals in 1984. And it was based on the National Healthy Mothers, Healthy Babies model with the purpose to improve the health of mothers and children in Montana. Today, our mission endeavors to improve the health, the safety, and the well-being of Montana families by supporting mothers and babies aged 0 to 3. And our vision is that there will be a safe and a healthy beginning for all babies in Montana. HMHB's early work included conducting a women's health survey, surveying the health conditions among migrant workers, creating a resource directory for maternal and child health, promoting an adolescent health plan, establishing a council on maternal and child health in Montana, and implementing a hotline for Montana pregnancy risk. Then in the 1990s, HMHB's programs expanded and then included a statewide teen health and pregnancy prevention program, the Baby Your Baby public education campaign, which urged pregnant women in Montana to seek prenatal care, a lot of breastfeeding promotion, some technical assistance for the Montana Hunger Coalition, and an educational campaign on nutrition and healthy eating habits. Now, many of you have worked with us through our Essentials for Baby program, also known as the Cribs and Car Seats program, the Period of Purple Crying Head Trauma Prevention program in labor and delivery units, the Learn, Play, Provide Infant Safe Sleep campaign, and most recently, the Montana Children's Health Data Partnership Project. So as we connect with local communities throughout the state, we continue to hear these consistent themes. And rising to the top are concerns about mental health, substance use, and suicidality in the perinatal period, and then all the effects that these conditions have on multiple generations of families. So our current work also has a large focus then on advocating for improved access to care for mothers before and after birth, And then including increased support for those who are experiencing mood disorders or substance use disorders or both through our screening protocols, trainings we provide, the Meadowlark initiative, the Look Closer campaign to promote recovery, and the PRISM perinatal psychiatric consultation line for providers. Each year, we continue to host our annual perinatal mental health conference. This will be our 5th year, and again, we'll be going virtual. The conference will be November 2nd through the 4th, and it's targeted to anyone who's serving pregnant and parenting families. If you'd like more information about our upcoming conference, you can visit our website. And then what I'm here to present on today, our LIFTS online resource guide that supports families expecting and those raising young ones. Our work on LIFTS really dates back to 2018 with a grant that Healthy Mothers, Healthy Babies received through Blue Cross Blue Shield. The original focus then was to create resource guides, to start some coalitions with shared goals, and then some peer networks for support. And in 2021, Healthy Mothers, Healthy Babies worked in partnership with many of you and your organizations through coalition launches to really visit about perinatal mental health and to talk about how we can improve the system of support in this very important perinatal period. So at all turns, we ended up with 2 questions. Number 1 being, what exactly are the local resources? And then also the resources throughout the state. And then number 2, what are the ways that families can connect to those resources? And so this was really why LIFTS was created. LIFTS was developed to help parents and caregivers who was struggling to find needed resources to support their families. It was developed to help family support providers like all of you who were spending too much time seeking referral sources both within your communities and beyond, as some of your patients and clients have traveled to you for care. So I'll share an example of this that I often share. So I live in Choteau, and we have limited prenatal care nearby and no delivery hospitals in our county at all. So the nearest area with any delivery facilities is in Great Falls. So prenatal care providers, labor and delivery nurses, case managers, care coordinators, or any other care providers within that Great Falls area may not always be familiar with all the supports in our Choteau area. So they could use LIFTS to find support services for their patients and their clients in the client's own community. And then this would allow the family, when they went home, to be supported locally during this new stage of their life. And then it helped many new parents and caregivers who feel isolated find social support environments. And this is also a time for families new to recovery or living in recovery. That's a really hard time for people to find their social supports and communal activities. And so the guide was then to also offer some events for them to go to as well. So the idea then was to develop this community-driven online resource guide that's easy to access, that's completely searchable, and so that it would help family supports. So again, all of you refer to other communities, and it would also empower families with the information when they needed it. So we did this by partnering with community coalitions and many other organizations to gather those on-the-ground resources in order to create this resource guide or this landing area for all perinatal resources. We really wanted to empower parents and caregivers because as a parent or caregiver of a young child, they become responsible for finding a lot of information about what their family needs in a very short amount of time. The LIFT's online resource guide was designed so that they could search for resources in their specific area quickly and easily. And the services include everything from childcare to mental health providers and are organized in categories that are useful to families with children under the age of 3. All the events also listed on the site are family-friendly options to help them connect with other members in their community. In the spring and summer of 2021, we collaborated with early childhood coalitions and other community organizations throughout the state to gather the on-the-ground resource information in all of their local communities. It was really important to get events and resources from that local level to help families in the communities that you're working with. We wanted to increase the awareness of services and events. And so the coalitions gathered the contact information for all of the support services in their communities, and they shared all of that with us. So the goal then was to provide services and supports that are useful to all of you on this call. And in return for all this help to build our LIFT's database and website, we were able to give the coalitions mini grant funding to continue the good work that they're doing in their own communities. We also performed some system level outreach to collect data from partners to update and expand upon information. And then we engaged with SciGaia for all of our site development. We appreciate these coalitions and want to acknowledge the contributions that they made to really help develop LIFT's. I'll take a moment here and read all of them because they really do need to be thanked, appreciated, and noted for all of the work that they did. So Dawson County Best Beginnings Coalition, Butte Community Council, 0 to 5 Lincoln County, Bighorn County Best Beginnings Community Coalition, Early Childhood Coalition of the Greater Helena Area, Boys and Girls Club of the Northern Cheyenne Nation, Best Beginnings Early Childhood Community Coalition, the Flathead Best Beginnings Community Council, Head Start Missoula, Mineral County Health Department, Central Montana Coalition for Family Health, Anaconda Deer Lodge County Best Beginnings Coalition, Healthy Spark, Roots Family Collaborative, One Health, Gallatin County Health Department, Great Falls Early Childhood Coalition, and Hill County Health Department. Again, thank you to all of those coalitions and all of your work. So LIFT's was really built to assist. The guide addresses the need to improve awareness and access to community-based services and events for families during this perinatal period. The guide lists over 2,500 resources for families from pregnancy through age 3. It's also a helpful tool for providers making these P3 referrals. You all are then able to find the local resources, contact information all in one place, as well as looking for resources in other areas for your clients. The guide really does empower parents and caregivers to look for help on an appealing, easy to use website. And again, it lists community events where families can connect with others. It's easy to update, and so the information can always stay current. There's absolutely no need for printing and distributing paper resource guides that quickly become obsolete as services and contact information changes. So on this slide, you can see our LIFT's family of supports, and each one of them complement the other. Our online resource guide, our LIFT's magazine, and then in the middle, our LIFT's warm line. Online resource guide contains the resources all throughout the state. The magazine shares stories of what helps and when help has helped. Our warm line offers assistance if someone can't find what they're looking for on the LIFT's resource guide. So there's several ways to find the resources that you may need. Our team at Healthy Mothers, Healthy Babies strongly believes that connection and thriving go hand in hand. And we really, really want expecting parents and families who are raising young children to link into all that Montana has to offer. Here is the homepage for our LIFT's resource guide, where families and providers alike can get connected to the network of support available all across Montana. Our resource guide online is mobile friendly because, as we all know, parents and providers alike are often searching on their phones. It was important for the guide to function well on all avenues of access. The prenatal to 3 services, or the P3 services in the LIFT's guide, are searchable. You can search by location, so by city, county, reservation, or zip code. And you can also search by 30 different service types that are relative to this perinatal time period. So I'm going to go ahead and read the 30 service types included in LIFT's, just in case some of you are just listening and aren't actually watching the PowerPoint. The service types are attachment and bonding, birthing and parenting classes, car seat installers, certified nurse midwives, child care supports, child development information and support, dental services accepting Medicaid, domestic and interpersonal violence resources, doulas and other health birth professionals, family planning, family practice, family support and education, food and nutrition supports, housing, lactation support, Medicaid enrollment assistance, medication assistance for substance use disorders, mental health professionals, obstetricians and gynecologists, other legal and social services, pediatricians, peer support specialists, play spaces, psychiatric services, public benefits enrollment, public libraries, school-based health centers, substance use disorder treatment providers, supplies for pregnancy, breastfeeding, and baby care, and support groups. So we went to coalition meetings and community meetings and really asked support service providers what's missing. And the 2 that we heard were the play spaces and the parent-child therapy. So that's why our 2est new additions to that list are play spaces and attachment and bonding. The resource guide also lists family-friendly, substance-free, or substance-limited events to offer really community spaces for everyone to connect safely. Connection with others in the same stage of life helps families to thrive. And you can find social events and support groups throughout the state on our LIFT's resource guide. An event is considered a substance-free zone if the event is either alcohol-free or has a designated or limited area for the consumption of alcohol. An example like this may be a fair that has a beer garden. In this instance, the family can plan and prepare to not spend time near this specific area at the event. We hope that this helps families with individuals in recovery find communal or community spaces where they can all feel comfortable. Families living in recovery or sobriety need social spaces where they really don't have to worry about alcohol or other substances being present. Here are the event categories that are listed on lifts. There's classes and lectures, community, cultural events, a miscellaneous event area, movies, music and arts, outdoors, physical activity, and sports and recreation. Next, I'll show you a few slides of what our website looks like. So you can access lifts at hmhb-lifts.org. You can also visit our Healthy Mothers, Healthy Babies website. And so if you go on that site, you'll find the lifts online resource guide under the Get Connected menu at the top. So once we're on the home page of the lifts guide, at the very top, you'll have options from left to right. There'll be services, events, magazine, and the warm line. And then over on the upper right-hand side, you can see search by resources and set your location. So I've actually set my location to Shoto. The other option to search for services is that you can click the magnifying glass in the center or the middle of the page there, and that way you can look for specific service types. So by clicking that magnifying glass, you'll come to this page in the guide where you can really narrow down your search. If you click on the service type, a drop-down menu will come up with the 30 different service types. You can also choose services by county, by reservation, or by city. So if I clicked the select a service type and chose food and nutrition supports with Shoto chosen for my city, my search would bring up Teton County WIC. And under the Teton County WIC name in Shoto, Montana, you'll see that view more details. If you were to click that, then the listing for Teton County WIC loads and you can view all of the program information and the contact information details. If you wanted to search for an event, you would click on events at the top menu of the page. And you could either choose a category for an event category, but in this case, I just wanted to see any events that are in Hardin. So now that the event has loaded, if I wanted to, I could click the view more details for more information about the River Valley Farmers Market. I would really encourage you to look up your program, your agency, or your organization and see if it's already listed in lifts. If not, you could always submit your service using the Submit a Service form at the bottom of any page on lifts. If your service is already listed, please check and see, does the information look correct? Is it missing any important details? Do any edits need to be made? And if so, you can go to the bottom of the page and click the feedback button and let us know what needs to be changed. We have a process to quickly update changes on the back end of the site. And of course, you're always welcome to add a virtual or in-person event in your community. We also publish our lifts online magazine. The magazine was created for Montana families who are expecting or raising young children. It's a collection of stories and shared experiences aimed to really support and celebrate the dedication of Montana caregivers. The magazine's intention is to offer encouragement to seek support by telling the stories of when help has really helped. Our hope is that by sharing personal caregiver stories in our magazine, that this will help us all understand that we're not supposed to do this alone. And hopefully it will inspire families to seek support when they need it. The magazine is an avenue to drive readers to the online resource guide and to help them find what they need on LIFS. In August 2021, 16,000 copies of the LIFS magazine were printed. So this was enough to reach the current birth rate. We mailed them out to distribution pathways, including delivering hospitals, home visiting sites, WIC clinics, child care connections, and many other family support agencies. You're able to view the magazine online and also download a PDF if you'd like to. Our publication date for our next LIFS magazine will be coming soon. And if you're interested in receiving copies, please reach out to us. The magazine is available on the LIFS website for download. And then as you can see here, you can also click through the online version. We also offer our phone number to call on our LIFS warm line. And so our HMHB team answers a warm line to help really, if you're not finding what you need on LIFS, if you're having any internet connectivity issues, sometimes you might not know exactly what your problem is, or you might not know what it's called, or you may not even know what you need to address it. And so we're always happy to visit with you about that. And then sometimes the best solution is to really talk with a person about what you're looking for. The LIFS warm line number is 430-9100. Our anonymous warm line is designed to help parents, caregivers, and professionals find the resources that they need. We definitely want to acknowledge and make sure everyone knows that this is not a crisis line. HMHB answers calls between 9 a.m. and 5 p.m. Monday through Friday. And if you call after hours, please leave a message and we will return your call within the next 2 business days. Since this is a recorded presentation and there's not a Q&A session or portion today, I'd like to share with you a few of the questions we receive most often about LIFS. So the first one is, why does the website ask for my location? So the list of services and events on LIFS is organized based on your location so that you can find information on resources closest to you. When you first visit the website, you might be prompted by your internet browser to allow location, which will automatically set that location in the top right-hand corner, which you saw where mine was set to Shoto. You can also change this manually by selecting my location and entering the city or zip code closest to you. The website only includes resources from the state of Montana. So if you select an out-of-state address, then no services or events will be shown. Are the listings on the LIFS resource guide endorsed? Healthy Mothers, Healthy Babies does not endorse any specific providers on the website. The lists are intended to be comprehensive and will continue to accept new submissions of services or events that were not included in the initial collection process. These lists are not reviewed against any databases from the Montana Department of Labor and Industry, for example, or the Board of Behavioral Health. How will I know if the provider takes my insurance? The website does not include information about the types of insurances accepted by each provider. We recommend that you reach out to each service directly to get the most up-to-date information on insurance. How often is this information updated? Okay, so the information found on LIFS was initially updated in August 2021. And so since then, new services and events have been added, while others have been updated based on your feedback or changes that the early childhood coalitions have come across. So on each page, you can find a last updated date in the top right-hand corner. And that way you'll know the most recent time period that the information was updated. What does it mean that a service is included in a vetted guide? Okay, so a vetted resource guide is a list of providers that have been found to meet a minimum criteria of experience and training in working with a certain population. So vetted resource guides are helpful in making appropriate referrals for patients and clients during that perinatal mental health, during the perinatal period. It also helps perinatal mental health professionals communicate their specialties to others. So on LIFS, we highlight perinatal specific vetted resource guides from around Montana, and there's 3 of them. There's one in Helena, Gallatin County, and then Flathead Valley. And so you can visit our Healthy Mothers, Healthy Babies website for more information on the vetted guided resources. And then we also include a toolkit to assist groups in building a list of vetted resources in their own communities. What is a PMHC? Okay. In 2018, Postpartum Support International, or PSI, created the Perinatal Mental Health Certification Program and began offering a specialized certification for mental health providers who specialize in perinatal care. So those who earn the certification, the PMHC, have actually met a standard of experience, training, and testing, and are required to continue their education on perinatal mental health. So on LIFS, we highlight PMHC as a way to help providers and families make the best connections to services that are appropriate for their needs. You can visit PSI online for more information about the PMHC certifications. So we really want LIFS to be a useful tool to make a difference in all of your work, and we will continue on our end to improve it with your feedback. HMHB has an open door. We really want you to let us know what we've missed. We're committed to continually improving it, and we want it to continue to grow to help the families in Montana thrive. We're here to help you do important work for the families in Montana. Please share with us how it helps and how we can also make it better. We'd like to give a special note of thanks to our funding partners, the coalitions, and SciGaia for helping us build the site. We have plans to sustain LIFS through additional grant funding and commitments with the Early Childhood Coalitions, WIC, Child and Family Services, and other large partners invested in maintaining access to resources statewide. I'd really like to invite you to take a few moments after this presentation and check out our LIFTS resource guide. And again, see if your agency or program is listed and send us some feedback. If your service isn't listed, go ahead and submit it so it's listed on this resource for care providers and families to find. Please reach out to me to learn more about LIFTS or any of our other programs. I'd be very happy to answer any questions and learn more about how we could both work together. I'm also available to join any coalition, organization, or leadership meetings to share about our LIFTS resources in your community. I want to sincerely thank you for all of the good work you are doing in the lives of families and children here in Montana. Thank you very much for listening to our LIFTS presentation today, and have a wonderful rest of your day.